So what I really appreciate most about Governor Whitmer is that every time she speaks about COVID and she speaks about students returning to school, she's indicated that she's going to allow the data and the science to drive her decision making. And I really appreciate that. And I'm following the same approach at the Detroit Health Department. We are a public health division, a public health department, and we are going to also allow the data and the science to drive every decision that we make. And so the Safe Michigan Start Plan was designed with that in mind in order to bring back students in a safe and equitable way. We spent a lot of hours making sure that students felt safe, and also families, they also felt safe. This is a 63-page document. It's actually sitting over here. And it is full of a lot of information, data, FAQs by each phase. And so if you haven't already seen the 63-page report, please make sure you review it. All of your questions, the majority of them, I believe, will be answered there, and I really encourage you to take a look at it. If not, I encourage you to reach out to your local health department, because each local health department every week will be meeting with local schools. And so the Detroit Health Department, as well as the Wayne County Health Department, we've been meeting weekly for the last several weeks, and we've developed our own kind of return to school roadmap, which is based upon the return to school roadmap. Essentially, it's a little bit different, but we're providing additional guidance, and we're answering many of the questions that parents have been asking us, other local health officers have been asking us, schools, districts, and so we put it together in this really cohesive virtual binder. We talk about face coverings, about testing, health screenings, what to do when a staff gets sick, what to do when a child gets sick. We provide templates, different scenarios, so it's a really informative document. And also it says who to call for what. So if you are a Detroit student, you're going to call the Detroit Health Department. If you're in Wayne County, you will call the Wayne County Health Department. Now, quick kind of food for thought. I probably answer this question every day of the week. What is the difference between the Detroit Health Department and the Wayne County Health Department? Because Detroit is in Wayne County. And that's true. Detroit is in Wayne County, but we have separate health departments. So if you are in the city of Detroit, you fall under the Detroit Health Department. If you are in any other city that's in Wayne County, not including Detroit, you'd fall under the Wayne County Health Department. So I think this roadmap will be extremely clear. The roadmap will be finalized next week. We're making a few tweaks, and it'll be available for all of the schools, all of the districts, and the families, if they have an interest. They can also have this virtual binder. So in terms of my opinion, my public health opinion, I believe we're definitely taking the right steps to open schools. We're being extremely safe. This is not rushed at all. If you recall, COVID over the last several months, we were very much deliberate on the decisions that were made, of course, at the state level, but also at the local level. The same applies to the school. We will not be rushed. We're going to be really deliberate, again, to make sure that families feel safe before their students return back to school. We took a careful approach and made sure that the roadmap was clear in its guidance. I realize it's a hefty document, but it was really important to make sure all of the bases were covered. And again, I do want to just reiterate that all schools need to work closely with their health departments. Especially reach out to your local health officer, and that would be me. We are here to serve, and so make sure you call us, send us an email. I check my email. So send me an email. It's just healthofficer@detroitmi.gov. Again, healthofficer@detroitmi.gov. And I typically respond that same day for whatever questions you may have. And again, I encourage you to reach out if you do have specific questions.
How can we help teachers and students stay safe when they are going back? So can you just maybe do some really, what are maybe some of top 3 safety measures that are outlined in the plan?
Sure. So there's a lot of discussion about facial coverings. And so it's really, there's explicit guidance in the state level work plan. But I do want to make sure people understand that if you are in between the ages or the levels K5, kindergarten through K5, facial coverings are not required when you are in the school setting. So when you are in the classroom, you do not have to wear your mask. Again, if you are pre-K through fifth grade, it's been a long time since I've been in school, so I forgot some of the names. But when you're out in the hallways, it's really important to wear your mask. If you are taking the bus to school, you are required to wear your mask. So that's really important. If you are above K5, so between 6th grade through 12th grade, you are required to wear your masks at all times except for eating. For staff, it's really important. Staff are required to wear their mask at all times. It doesn't matter if you're in the classroom or on the playground, you need to wear your mask at all times if you are a staff. Face shields is a really interesting topic. Facial shields, those are the plastic ones, and I usually have some over here, but I don't have any. That is not enough because face shields don't provide protection for when you are speaking. Droplets are spraying. They can also spray downward. So it's really important. You can go ahead and wear a face shield, but you also have to wear a mask that covers your nose and your mouth. And let me just take the time to demonstrate how to wear one of these masks. This is a surgical mask. And when you wear your mask like this, this is a fashion statement. That's all this is. This does not protect you from anyone or anything. So it's important to make sure that you are covering both your nose and your mouth, and that's going to protect you. And also, one more thing too is sometimes these surgical masks can they're kind of flimsy, so you can double them up. And if you double them up, they'll stay put a little bit longer. So facial coverage is really important. And then also social distancing. So the classes, when you return back to school, the classes are going to be a lot smaller. There won't be 30, 40 kids packed, but it should be a limited amount of students. And we'll make sure that these students are spaced out so they'll practice social distancing. So those are some of the things I think are really important, and they're outlined in the return to school roadmap.
How often should kids and teachers be tested if they're in person at school? Is there a recommendation around that?
Yeah, so I'm not a physician, so I can't really speak to the clinical guidance regarding the cadence of testing. I believe that's still a conversation that is still being determined at the state level. I wholeheartedly believe that if you have symptoms, the first thing you need to do is to self-quarantine and then to call your physician to figure out next steps. At the Detroit Health Department, we have a variety of different testing options available to residents, not only in Detroit, but Wayne County, Macomb, Oakland. They can go to the state fairgrounds to get tested, and results are given within a few days. So I think that's really important. If you are feeling those symptoms, to immediately, again, self-quarantine, call your doctor if you would like, and then go and get tested at the state fairgrounds.
How do we expect children to keep masks on at school? And then if K through 5 aren't expected to wear masks in the classroom setting, wouldn't that cause an increase in transmission?
So we are requiring that all teachers wear the mask, and we're requiring that they practice social distancing. So they should not be close to students at all. And I'm trying to make sure I'm clarifying my statement. Kindergarten through K5, or excuse me, kindergarten through fifth grade, they typically are around the same children every single day. They're not changing classes at all. And so that was decided, and we spent a lot of time talking about who should wear masks and who should not. And I wholeheartedly believe that kids who are a little bit younger are going to spend most of the time playing with their mask rather than focusing on learning. And so we did not make it a requirement. And that could potentially change. But at this point, as long as the kids are spaced out, they're practicing social distancing, the masks are not required. Now, if your children still want to wear a mask when they're in school, that's perfectly appropriate. But that's not a requirement, again, for that age range.
Just a quick comment. Washing
Yeah.
hands, I've seen in some younger groups, it's also so critical that the routine washing of hands for that preschool and K through 5, even if they're not wearing masks, that process helps to keep virus transmission down. So those parents can encourage their kids to just get in the habit of doing that. And there should be sanitizer in the classrooms where they can do that sort of thing. And I think Denise would agree with me there.
I agree with you.
How do we ensure teachers are safe in K-5 if they're not required to wear masks, particularly if they're asymptomatic?
Yeah, so once again, so I want to make sure I'm really, really clear. So the teachers are required to wear their mask. So they cannot,
Always.
yeah, so always at all times, except for meals. If they're, eating, of course, they
Right.
don't have to wear their mask. But at all times, and this is explicitly stated in the return to school work plan. I can pull the page number in a few minutes. But again, as long as they are practicing social distancing, we know from the science that if you wear a mask and if you practice social distancing, the risk of transmission is extremely low. And so that is the guidance for that particular question. But again, if you want to make sure that your kids wear masks at all times, that's up to you as a parent. But again, that is not a requirement.
Will there be a contact tracing plan for each school?
So contact tracing is at the state level as well as the local level. And so whenever a student tests positive, the process is for the health department to follow up accordingly. And yes, there is a robust contact tracing plan. It's at the local level. Each school should make sure that they are partnering with their local health department. I received a work plan from a school the other day, and they did not know that Detroit Health Department was their main contact. They had no idea who to contact. So it's really important that if you don't know who your local health department is, let me be very clear. If you live in Detroit, if your child goes to school in Detroit, then they would follow up with the Detroit Health Department. If your child is anywhere else in Wayne County, not including Detroit, then you would follow up with the Wayne County Health Department.
What is the quarantine protocol if my child's teacher has had COVID? Should I take my child for a test? What are the age differences for this for preschool versus high school age? If there is someone that tests positive, does the whole school shut down? Does it just one class that does the whole class get tested and then do a 14-day quarantine? So really the question is, what happens if someone tests positive?
Yes, so I think that is a great question. And all of the guidance is in the Michigan return to school work plan. But let me just kind of give you a couple different scenarios. I know we're running out of time, but I think your question was if a student has tested positive for COVID, or was it a teacher?
Child or teacher.
Okay, so if a child, and this is specifically stated in our Michigan return to school work plan, if a student or staff person has been confirmed with COVID, and I'm just reading this here because I want to make sure I'm clear, the student or staff and all of the household members are immediately excluded from school. So if you are a teacher and you've tested positive, you should not be coming to school at all, obviously, or if you are a student. And so the confirmed person must isolate directly at home, and the student must not return to school until it's been 10 days since the symptoms first appeared and at least 24 hours with no fever. So again, you're isolating at home. It has to be at least 10 days since symptoms first appeared and at least 24 hours without a fever. And also respiratory symptoms have improved. So there should be no coughing, no shortness of breath. And that is the recommendation. So again, make sure that you take a look at our Michigan Safe Start plan for additional scenarios, which we'll be able to respond to your questions about.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.